Hey, it's Dr. Matt Bradbury here. I hope you're doing well out there. I actually had some questions this week on Ask Dr. Matt in regards to getting back after you've been cleared for surgery or overcoming an injury, especially getting to move better, especially if you have some joint contractures and things that aren't moving as well as they should. So one of my mentions, somebody I talked to actually had a femur break, and this was 10 plus years ago, and they're actually trying to get back to movement. And by the sounds of it, squatting was something that was out of the question at this point, and they hadn't really worked up to. So remember that you're often a product of your habits. So what that means is that if you've gotten from out of that emergency situation, especially perfect time for medicine, you break your femur, get repaired, and then back on track. Once you've healed, that's the first step. And now the next step is restoring movement so that you can actually acquire good movement again. And a lot of that is a training process. And if you just do nothing and don't use your knee or your hip other than to walk to work and do various tasks around the house, then you're not going to be going through a full range of motion to help improve the hip and the knee again. So one thing I wanted to give you is just find yourself a tool, and one thing I like to use is just the squat. So actually get yourself in a squat position, feet, big toe 10 to 20 degrees out with your foot position, hips a little wider than or feet a little wider than your hips rather. And what I would do is just squat down, right? So first of all, see how you can squat and see where it's stiff and doesn't work quite right. Maybe you shift to one side, check yourself out in a mirror, squat down and find out where you're stiff, right? So for this person, I had a feeling it was more or less around the lower quad region, right, through here. Now, where you're gonna get your biggest effect on changes, especially if you get a lacrosse ball or a foam roller, is actually going to be muscle changes in the tendon that attaches to the bone. So try to use the tendon area, right? So if it's the knee just above the patella, the kneecap, and right where that teardrop is on the inside of the kneecap, and on the outside you got the medialis and the lateralis, the quad muscles. So I want you to try a real simple one. If you don't have access to a foam roller, start right here, hanging out in this position. Just get your knee through a full range of motion. So what I would do is actually just start here, my bum to my heels, hang out here, and just, while you watch TV, while you scroll your feet on the phone, whatever it may be, hang out here for 1 to 3 minutes. I'm on my toes right here, and now try as well. Feet are now flat, toes pointing back. And the same thing, you're checking your phone. Notice I got some support here. I bring my phone to eye level, or I'm watching my favorite show, hanging out on the carpet or the rug at night. So try that. Again, 1 to 3 minutes, hanging in that position regularly, right? With the other one, I would just grab a foam roller, and you can see here, you can start with a lacrosse ball. I like a lacrosse ball just because you can be very specific with it. But this is actually a foam roller. It's homemade. Just a piece of 3-inch ABS pipe, and wrap some hockey tape around it so it doesn't slide too much. Now what I would try with this is actually laying on your stomach and going over some of the regions, especially where the quad muscle comes down, starts to attach to the patella. Right? So on my knee, I'm going to stand up on the bench just so I can show you better today. But right through here, here's my kneecap, so right through here and right through here. And what I would do is just hang out on that region while you're on your stomach. Breathe, because it's probably going to be really uncomfortable. I would hang out there. You can go through a range of motion with your knee. You might find it too much at first, so you can just try trigger point, hang out. You can take some pressure off with your opposite leg and your hands in the push-up position, but I'll show you that now. So when you're down here, just set up. And I like it on a bench as well because you can actually keep yourself supported with your other leg. But what I'm doing is just going through a range of motion. And if it's really tender, too much to move, just hang out there and breathe into it. Again, 30 seconds, 2 to 3 minutes in that range. When it gets easier, you've done your job. Okay? So don't go so much for time as when it gets easier, you've done your job. All right? So try that. And again, lacrosse ball or piece of ABS pipe works really well. So try those two things. Last step, especially if you've developed some contractures through here in your quad and you're not moving as well as you could, is the couch stretch. I like the couch stretch because it addresses a lot of that anterior muscles from your spine down to the top of your femurs. So what I would do is grab a cushion. Imagine that you are on your couch. Top of your foot goes on the headrest of the couch, knee goes on the bottom of the couch. And all it looks like is just like this. So from here, and this portion goes up on the back of the couch, and I hang out just like this. It's easier than this because you actually have the couch to assist you. So hang out, breathe, and what I want you to do is just squeeze your glutes a bit to push your hips forward, keep yourself in a straight line here. So there you have it. Those 3 movements. The one just sitting on your knees, the other one using the foam roll, lacrosse ball, and the final one is the couch stretch. Try that, and what I would do is I would squat, right? If I was gonna spend 5 minutes a night on this, I would squat, right? So do my squat. See how I move, and then I would try those things for 5 to 7 minutes, and then I would squat again to see if I've made a change. You can use it as your mobility warm-up at the gym. You can use it as your nighttime routine, right? Just to get back to squatting. And the reason I wanted to address this question is because I feel like if you keep going through the same habits over and over again, you're always going to say, I have a bad knee, bad hips, or I can't squat and move properly, and it's always going to inhibit you from going to the gym. You're going to spend one more time doing upper body. And I really feel a lot of the benefits from strength training come from actually learning how to squat and use your lower body so that you can actually have an activation, enough muscle mass, change your hormones, fat loss, build more bone strength, build more muscle mass, and be healthier and have better quality of life, right? And a lot of strength markers play a role in quality of life and longevity as well. So keep that in mind, those 3 things. And it's nice to have the pre and post test. Let me know how it goes. I'd love to hear your thoughts down below. So reach out if you want some help. And if you really want some help, send me a picture of your form, squatting or lunging, and I'll show you some tips and tricks, and we can converse as well in the direct message or the private message feed if you don't want to share in the comments feed, okay? Otherwise, again, this is Dr. Matt Bradbury here at One Life Family Chiropractic in Georgetown, and I'll talk to you guys soon. Bye for now.